Hello and welcome to the Oaktree Connect Podcast. I'm your host, Emma, and today we're diving into the topic that's quietly affecting millions across the UK and around the world: loneliness. It's a topic that needs all of us to understand and address, and you, our listeners, play a crucial role in this. It's more than just a feeling. Loneliness has real consequences for mental health, physical well-being, and even the way our society functions. To help unpack this, I'm joined with Dr. Singh, consultant psychiatrist and medical director here at Oaktree Connect. Dr. Singh, welcome.
Thank you, Emma. It's good to be here, and I'm happy we are talking about loneliness because it's often underestimated. Many people see it as just being sad or just needing more friends, but the reality is far more complex. Loneliness is a deeply personal experience that has become a public health concern, actually.
Yeah. Let's start with the basics. How do you, as a psychiatrist, define loneliness?
Loneliness isn't the same as being alone. You can be surrounded by people at work, at school, even within the family, and still feel really lonely. It's about the quality of connections, not the number. If you feel that your relationships lack depth or you don't feel truly understood, that's loneliness. And when this persists over weeks, months, or even years, it takes a real toll on your mental health.
Yeah, that makes sense. I've heard people describe loneliness as being invisible in a crowded room.
Exactly. And that sense of invisibility can eat away at your confidence. People begin to think, maybe there's something wrong with me. Maybe I'm not worth connecting with. And once that cycle starts, it can be very hard to break without help.
Yeah, totally. So, what's the impact on mental health?
Loneliness is one of the strongest predictors of depression. It's also closely tied to anxiety, low self esteem, and even self harm in extreme cases. Think of it like this: humans are wired for connection. When we don't have it, our stress hormones rise, sleep is affected, and our thinking becomes negative and repetitive. Over time, this wears down resilience and increases the risk of severe mental health conditions.
Wow, that is powerful. And I imagine it creates a loop. You feel lonely, your mental health suffers, and then it becomes harder to reach out.
Yes, and that's the vicious cycle that I was talking about earlier. A lonely person often avoids social opportunities because they fear rejection. But avoiding these situations only deepens the loneliness. Breaking that cycle is one of the key things that we work on in therapy.
Yeah. And let's just talk about who's most affected. People often assume loneliness is only an issue for older adults. Is that true?
It's an unfortunate myth and a stereotype. Older adults do experience loneliness, that's true, particularly after retirement or bereavement or when their family lives, far away from them. But recent studies show that young adults report the highest rates of loneliness, especially those aged between 16 to 24. University students, for example, are in a new environment away from home and often under pressure to succeed academically and socially. Add in the social media comparisons, and many of them feel isolated even when they're surrounded by peers and even their friends.
Yeah. And so it's not just about physical isolation, it's also emotional.
Exactly. A teenager with 500 online followers or friends might still feel profoundly lonely if none of those connections feel authentic or close.
And what about society as a whole? Does loneliness really affect more than just one individual?
Yes, that is where it gets interesting. Loneliness reduces productivity at work. It increases healthcare costs because lonely people are more likely to visit their GP or develop chronic health conditions. Communities with high levels of loneliness often have weaker social bonds and lower civic engagement, and even higher crime rates.
Wow.
It's so serious that UK appointed a minister for loneliness in 2018, the first country in the world to recognize this problem and to do so. That shows you how wide-reaching the impact is.
Wow. That really reframes it. Loneliness isn't just an emotional problem, it's a societal issue with economic and social consequences. And by having this conversation, we're all contributing to a larger understanding and potential solutions. Let's make this practical. For someone listening, what are the signs they should look out for loneliness and how it's affecting their mental health?
Okay, so if you notice you're withdrawing from activities you once enjoyed, or struggling to sleep, or feeling persistently low and sad, those are the red flags to look out for. Another sign is constant self criticism, thinking that you're dull, unlikable, unlovable, or too much trouble for the others are other signs. And if those feelings are present most days of the week, it's time to reach out for support.
Yeah. And can that support be professional?
Absolutely. A consultation with a therapist or psychologist or psychiatrist provides a safe space to explore those feelings without being judged.
Mm-hmm. And could you give an example of how therapy helps someone struggling with loneliness?
Sure. Let's imagine a young professional who moved cities for work. They work remotely, so most of their days are spent at home, in front of the computer, most probably. Mm-hmm. Slowly, they start feeling isolated and anxious about making friends in general. They convince themselves that people don't want to really be around them and avoid social invitations. In therapy, we'd start by challenging that self talk and belief. Then we'd create some small, realistic goals, maybe joining a local class or scheduling one coffee meetup with a friend every week. And over time, these small steps rebuild confidence and connections. Therapy isn't about forcing socialization, it's about rebuilding the beliefs that you can connect meaningfully.
That's brilliant. So let's go back to social media for a moment. Many parents worry that their teenagers are always online. Is that fueling loneliness?
So this can be a double-edged sword, really, and could both help or be a hindrance. Online communities can provide support for people who feel out of place and are not geographically close to others that they know or are friends with. On the other hand, endless scrolling and comparing yourself to perfect or curated versions of other people or their lives can deepen loneliness. The key is to find the right balance.
Mm-hmm.
We can encourage young people to use digital platforms to enhance and not replace the real world interactions and connections. Families can set boundaries, such as free meals or shared activities, to strengthen those very important in person bonds.
Yeah. And for someone listening right now who feels lonely but doesn't know how to start reaching out, what would you say?
First of all, you need to know this: you're not alone in feeling lonely. Millions of people are in the same space, even if they don't show it.
Yeah.
Maybe like you don't. You could start with small talk. Talk to a trusted friend or join a group that shares your hobbies or interests, or even chat with a colleague. And don't hesitate to seek professional support. Therapy doesn't have to be a last resort, it can be the first step towards breaking this cycle. Loneliness is painful, but it is changeable.
Wow, that is a really hopeful message. Dr. Singh, thank you for sharing your insights. This conversation shows us that loneliness is more than just a personal feeling. It's a mental health challenge, a social issue, and something we can address with the right help.
Thank you, Emma. And to our listeners, if you're struggling, know that help is at hand. At Oaktree Connect, where I work, we offer private consultations with psychiatrists, therapists, and psychologists for children, adolescents, younger adults, or adults of working age. You could visit our website, oaktreeconnect.co.uk, to learn more about this.
Thank you so much, Dr. Singh. And to our listeners, let's remember, mental health is health. Loneliness doesn't have to be faced in silence.